Hello, good morning, good afternoon, everyone. October 2023, here we are. It's the month where we remember and try to tell the whole public how important breast is, especially breast cancer. So we call it Breast Cancer Awareness. Before we do anything in October, I always like to remember those ladies who have not been able to make it till date because they've passed on because of breast cancer. And also to encourage the new ladies who have just been told they have breast cancer within the last year. And the existing ladies who have continued to champion the information, the support they give to all the other ladies. Well done to us all. So the month of October is when we all think about breast cancer awareness. Please don't use October as the only time you are breast aware. Be breast aware every time of the year, every month of the year, because breast cancer can happen anytime. I have these wonderful two ladies here with me today who are just going to tell us a little bit about themselves and about their journeys. And good morning, how are you?
Good morning, Dr. Bello. How are you?
I'm fine. Can you tell us who you are?
Sure. So my name is Jennifer Cross, and yes, breast cancer warrior survivor queen. I'm very privileged to be here and to share my story with other women and the rest of the community.
Thank you so much for your time. And good morning to you. Can you tell us who you are?
Good morning, Dr. Bello. My name is Tatiana. I'm 44, and I had breast cancer last year. So I'm honored to be part of this podcast, so to share my story and to talk about cancer.
Thank you very much for your time. Can you just tell us how you got to know about your breast cancer, Jennifer?
Yes, so during COVID, as we all know, this was a very precarious time. No one could go and see any doctors unless you had COVID. So I remember being on a Zoom call and feeling very uncomfortable in my right breast and very itchy. And that was sort of for me like a telltale sign something wasn't right. I myself couldn't feel any lumps, so it just shows you that sometimes it's not necessarily visible or able to be felt by the person. And I finally managed to see Dr. Bello in February 2021. So I had to wait for around 6 months actually to be able to see anyone. Thank you, COVID. And I still remember that day when you did the test, and that particular day, everything sort of happened. We did the biopsies, you did not the diagnosis, but I think I knew that something wasn't right.
So just being aware of your breast, knowing what was different, made you come to see the doctors. What about yourself?
I realized that something was wrong when I was doing my physical exercises, and especially when with my daughter, because she was sitting on my legs, and I was not comfortable with my left breast. So I test myself and found that something is wrong. So the right thing which I did to go to the doctor right away. So I didn't waste my time, and I go for checkup. So, and how I realized that it was really something wrong with me.
So breast cancer, you can pick up either by finding a lump or just knowing that your breast doesn't feel right. These two lovely ladies are so fortunate that they didn't ignore the warning signs. They came immediately, and they're here today with us sharing their experience. So Jennifer, how was your journey after the diagnosis was made?
Honestly, I have to say that my journey here at King's was fantastic. I really felt supported. I felt comforted. The medical team, your team, the oncology team were always there on hand. And it just so happens that I was actually the first breast cancer patient here, so I was like the guinea pig in some ways. But with that, I never felt that I was on my own. And I think being surrounded by so many caring people, by a medical team that is there on hand 24/7, makes you want to, fight. I mean, it's already a struggle, but when you know you're separated from your family, again, thank you, COVID, when you know that you're not able to do the kind of things that you should be able to do with, support groups, because obviously we were all in quarantine, the medical team were there on hand all the time. So the journey was tough, of course, but I can honestly say that King's really looked after me.
And Tatiana, we met last year, and
Yes.
how has the journey been so far?
I can tell that with you, the journey was not so tough as it could be, because I'm so that you made my journey so comfortable, because I made my own choice, but in consultation with you, and it showed me how strong I am, how that this is not the end of the life. I can fight, I can be healthy, I can go through this. So I could say that this was a good journey.
What can you share with other ladies who are yet to go on this journey, or those who have just started this journey, that can make life a little more bearable for them? Because a lot of people dread going to hospitals when they have signs of things that can be wrong with their breast. October being Breast Awareness Month, what can you tell the population out there what not to do and what they must do when they have issues?
I definitely think that we must demystify the stigma that cancer is necessarily going to cause mortality. I think there are so many ways that we can take action, but the one thing that I will say to all the ladies out there is to feel comforted that not all the time are we diagnosed with breast cancer. It might just be, a lump or a cyst. But if you are unfortunately diagnosed, there is a path. There is a great survival rate. And I think what's most important is our mindset, is believing that we are able to fight this, not just on our own, but collectively with the medical team and with family and friends.
So it is a journey that you need to hold hands with several other people to make, not just with the medical staff, as you very likely alluded to. We mustn't ignore our friends, and breast cancer is not a life sentence. What kills women when they have breast cancer, it's ignoring the diagnosis and ignoring the right treatment. These two wonderful ladies have had two different journeys. Can you tell us what your treatment has entailed?
So I had a mastectomy. After 6 months, I had reconstruction, and at the end, I had radiotherapy, and I'm taking also the medication. So it was not the easy way, but I had only 11 months of treatment, so it could be more. So I found the cancer in early stage, so that's why I could make it the treatment shorter. So yes, but I'm okay right now.
And Jennifer, how was your treatment?
Well, I got this full suite. I went through the full, the triple threat. I had chemotherapy, I had the lumpectomy, and I had the radiation therapy. And I think my journey, I mean, every woman's journey or every person's journey is different. But what I loved about the fact here is that I had a choice. They gave me a choice. And we decided to do chemotherapy first, whereas often it's done secondly, to see whether or not, and I remember by your guidance, whether we could reduce the lump or the tumor to a size where it didn't require a mastectomy. And so I did respond well to chemotherapy. But as you well know, Dr. Bello, I'm one of those patients that had infections, rashes. So you saw me here pretty much every day, but it didn't detract from, my spirit. I think I knew that I was in good hands, but that is just to sort of frame that every journey is different. I did have, unfortunately, quite a lot of reactions to not so much the chemo, but believe it or not, to all of the tape, the bandages. So yeah, lucky me.
So as you can see, these two ladies have had different kinds of treatment, different journeys. Sometimes with breast cancer, the whole breast tissue needs to be removed, and sometimes only partial part of the breast needs to be removed. So chemotherapy is not what we always think it is. People think chemotherapy is a life sentence and it means your cancer is really horrible. No, it doesn't mean that. We use chemotherapy sometimes, what we call downstaging, to make it smaller so that you can have a lumpectomy, which was exactly what Jennifer did. And Jennifer now lives life to its fullness. You can tell us a little bit more about what you've gone to do since your breast cancer diagnosis.
Well, I'm a little bit of a wild adventure woman. And obviously, many people think that once you've been diagnosed with cancer, as you said, it is your life sentence, and it isn't. I will honestly say that it has inspired me to even become better, more bold, if that's even possible. Post my treatment, I actually went to Austria to do my first hike and do some detoxing. And then I ended up going to Antarctica. And I went to Antarctica earlier this year, and we'll be hosting a trip for potentially like-minded adventurers and cancer survivors. And I actually just came back last night from a hiking trip in Salalah in Oman. So I guess, as you said, it actually doesn't, it changes your life for the better. And I go back to the fact that it's a mindset. It has made me appreciate life even more. It's made me live life to the fullest, but being very aware now of my health and the nutrition and the choices that I make each and every day.
Tatiana, I know you have a lovely, wonderful family support.
Yes.
And just tell me what you said about your breast after you had your mastectomy and how you feel about your breast just now.
I'm completely perfect. I'm enjoying my breasts. I can tell you that like any treatment comes to the end, and you will not forget like all the moments, only like the big pictures of the treatment, and you enjoy your life more than then. So I can tell that I became stronger. I became more happier.
So these are two ladies who normally would be so private about their life, but they're sharing their deepest thoughts with us today, sharing their experience that having breast cancer doesn't mean the end of life for anybody. Getting the right treatment, going to the doctor soon enough so that your cancer can be picked up. And going to the doctor soon enough is only by you getting to know your breast. So if for nothing else, all I can say is that let's all swing into action. It's October. Swing into action. Spur other ladies so that they can get to be breast aware, so that breast cancer will not be a life sentence, so that you can sit down and be able to tell the tale and encourage other women. Breast cancer is one of the cancers that people do so well with. If you had colon cancer or you had pancreatic cancer, you won't be sat around the table 5-10 years down the line to share your experience. But with breast cancer, we've moved forward. So please go for your mammogram. We've got every hospital in Dubai and surrounding giving offers. However, choose where you go to. Go where you know that the professionals there would do the right thing for you, not because they want to collect your money. It's not a money-making month. It's a month where we want women to be aware. Here at King's College Hospital, we do have mammogram and ultrasound scan at next to nothing. So if you feel comfortable or you live around here and you want to come here, please feel free to do so. And these two wonderful ladies, I cannot thank you enough for taking time to join us today. And at the end of October, we're actually going to start a support group for like-minded people who have journeyed through breast cancer or who have friends who have had breast cancer. And the invitation is open to anybody. It's a disease that we must beat. It's a disease that we must spread the news. It's a disease that we have to conquer.
Thank you, Dr. Bello.
Thank you.
Thank you. Thank you for your time.
You're welcome.